Hi, it's Dr. David Green, CEO of the Arizona Pain Network. Today's topic is we're going to go through the top 4 types of knee injections that are commonly used in today's medical practices. Now, knee arthritis is one of the most common types of arthritis. It affects over 20 million Americans, and it's either due to good old wear and tear arthritis, which is called osteoarthritis. It could be due to post-traumatic arthritis, if somebody was playing amateur professional sports, got into a car accident possibly, just something that happened that damaged some of the cartilage in the joint. Okay. Now, you can also have rheumatoid arthritis, which is an autoimmune disorder, can be problematic. There are others too, like lupus, psoriasis, arthritis, and things like that. So whatever the case may be, all these different types of injections are still used to achieve pain relief. Now, the first and the gold standard, and the one that's been done for decades now, is corticosteroids, known as cortisone as well. Now, why have these been the gold standard? Cortisone is an amazing anti-inflammatory medication. And what we found is that arthritis itself has a lot of inflammation associated with it. So when you inject steroid into somebody's arthritic joint, it decreases inflammation and provides excellent pain relief. So the question that most people want to know is, does it damage the cartilage in the joint? And the answer is, we're not sure. We think it does. It was shown in small animals when they did those studies. Then they repeated a cortisone study in the joints of large animals, and it had no ill effect. And we don't really know the answer. But they've persisted, and they're now the gold standard. You can do a knee injection with cortisone every few months. You don't want to do it too often because some of the cortisone can actually get into the bloodstream, and it can cause high blood sugar and other issues, maybe with your adrenal glands or whatnot. All right, but regardless, cortisone doesn't change the course of the arthritis disease. It just doesn't do that. It basically gives excellent pain relief, but arthritis is still present. So, but we know that over 75% of people who have a steroid injection into the knee get excellent pain relief for weeks to months. All right? So steroids are not going away anytime soon. But what we have seen in the last few years is something called viscosupplementation. In the knee joint, we have a substance called hyaluronic acid, and that really acts as a lubricant. It's almost like the motor oil for your knee. Because when your knee moves, cartilage on cartilage, if it's there, is almost frictionless. It allows us to do a lot of different types of movement very painlessly, unless there's arthritis. Okay? So the FDA, back in 2004-ish, cleared the first viscosupplementation. Now, it's made out of rooster combs. Not a lot of people know that, but rooster combs have a lot of hyaluronic acid in them, so it's processed through an FDA-regulated process, and it's really, really, really similar to the hyaluronic acid in humans. And it's injected through either Synvisc is one of the brand names, Hyalgan, Orthovisc. All of these have been looked at head-to-head in studies. There's no difference. They all tend to work pretty well. The overall good to excellent results is between 70 and 80% for 6 months or longer. Some of them are given in one injection, some are given once a week for 3 weeks, some once a week for 5 weeks. It just differs between the brand names. All right? But what you're going to find is that the outcomes are all super duper similar. Now, they are covered by most major insurances, including Medicare. And the last two are what we call regenerative medicine injections. Platelet-rich plasma therapy, known as PRP for short, involves taking some blood from your arm, 30 to 60 cc's, putting it in a kit and spinning it rapidly in a machine called a centrifuge for about 15 minutes. That separates your blood into 3 layers. The top layer is called platelet-poor plasma. That's discarded. The bottom layer is very red, and that's mostly red blood cells. That's discarded. It's the middle layer, which has a funky name. It's called the Buffy coat, which includes a ton of platelets, a ton of growth factors, and cytokines and a few other things that are really good for helping regenerate tissue. There's also a lot of white blood cells in there as well. So that can be injected into your arthritic joint. Now, there was a study done a couple years ago out of the hospital for special surgery, and they looked at just one PRP injection into mild to moderate arthritic joint of the knee, and the results were amazing. Over 75% got excellent pain relief, increase in function, and they did MRIs every few months, and they showed that the cartilage did not deteriorate any further. So studies have gone very well for that in the knee. Now, in addition to PRP, which is very widely done now for the knee, there are actual stem cell injections that are performed, and those are pretty mainstream now. They're not covered by insurance. PRP is not covered by insurance. PRP is going to run anywhere from $500 to $1,200, depending on where you live, where you are. And the stem cell injections either come from your own bone marrow, they can come from your own adipose, your own fat, or there's amniotic fluid-derived stem cell injections as well. And that's a whole nother video. But basically, these substances have stem cells in them. They have growth factors. They have some platelets and cytokines. Amniotic has a lot of hyaluronic acid. But basically, the substance is, if it's taken from your body, it's processed in the room and it's injected the same day. Amniotic fluid is injected. It's thawed out for 10 minutes and then injected. It comes to the procedural room on a dry ice. Okay, it's shipped in. What are the outcomes of the stem cell injections? Well, they're about 85% good to excellent, usually from 6 to 12 months or maybe even longer, depending on how bad your arthritis is. All right, so those are the 4 common types of knee injections that are performed in medical practices. The first 2 are covered by insurance, the last 2 are not, but those are the 2 that are helpful with repair and regeneration of the actual arthritis as opposed to just relief. All right, visit us online today at ArizonaPainNetwork.com. There's a ton of educational information and videos on there. You can see where the locations are that we offer treatment and some bios on the doctors and the phone number as well to call for treatment. Thank you for watching.